highly favors the ugly bacteria and disfavors our. You can handle a 15-minute dip in your pH, and your body, so that we can, for our convenience, carry it. Filter your own water, fill up your own bottle, and reuse. Some inflammation and gum bleeding. It can be unpleasant.
Hi, everybody. Welcome to the Kidney Coach YouTube channel. I'm naturopathic Dr. Fiona Chin, co-founder of the Kidney Disease Solution and head formulator at Hygenesis. And I am so thrilled today to be joined by the amazing Dr. Ellie Campbell. So let's dive in. So let's talk about this oral hygiene. And of course, people listening are going to have kidney disease, but as we know, cardiovascular disease is the second leading cause of kidney disease and changes in kidney function. And sometimes we have patients where you can do everything left, right, and center, and you can't quite get the blood pressure where it needs to be. Or it sounds like if you're not really treating this driver, you're still going to have changes in blood vessel health and endothelial health. So let's dive in.
So how do we make our mouth environment healthy? Right?
Yep, that was my question.
Well, first of all, it comes down to our fundamentals. We have to eat clean food. We need nutrition. We have to have nutrient-dense, antioxidant food that provides nutrition for our healthy mouth cells and our healthy bacteria cells. We have to have the right pH in our mouth. If our mouth is too acidic, that highly favors the ugly bacteria and disfavors our friendly bacteria. Well, I don't drink acid. Who drinks acid? Many of us do. Coffee is one of the most acidic things that we can drink. There are some more alkaline coffees, and they're coming out on the market, and I would encourage people to look at them. And just drink your coffee all in one sitting. Don't sip the cup all day long. Don't carry that 32-ounce coffee and sip it for 4 hours, because that's acid after acid after acid. If your pH in your mouth is below 5.5, you're going to start to dissolve the enamel. But you can handle a 15-minute dip in your pH, and your body will recover and make enzymes that neutralize that and bring the pH right back to 7 pretty quickly. But not if you keep deluging it with acid. Many bottled waters, including Dasani, are down in the pH around 3. So if you're sipping your Dasani water all day long, you are more at risk for changing your mouth bacteria. So I'm generally not a fan of bottled water in general, because I don't like the plastics in our environment, and I don't think we need to have perfectly good water put in a bottle so that we can, for our convenience, carry it. Filter your own water, fill up your own bottle, and reuse it. That's my preference. But if you're going to drink bottled water, please go online and check what its pH is, and make sure that it's in the neutral range, at least 7, 7.4, 7.5, maybe a little above that. So don't drink acid. And mamas who have babies, apple juice is equally acidic to coffee. So apple juice will rot your baby's teeth because it changes the pH. If you want your baby to have apple juice, give them a sip of apple juice and let them have it, but don't let them sip on it all day long in a sippy cup. It's bad for their pH. So we've talked about pH. Mouth breathing lowers your pH. Dries out the oral cavity, enhances the ugly bacteria. So we don't want to be mouth breathing, especially at night. We want to eat clean food. We don't want to rinse with acid things like, what about apple cider vinegar? How many people have started their day with a lovely glass of water with apple cider vinegar? That's very acidic. So drink it all in one sip. Get it all down. Don't sip it all morning long. It's not something you should drink like that. It's a one-shot deal.
Yeah.
Okay. So if I discover Porphyromonas gingivalis in my mouth, I want to get to an enlightened dentist for a protocol to help eradicate that. And part of that is almost certainly going to be a deep cleaning. We call this root scaling and planing, and it's a very deep cleaning, usually 1 or 2 quadrants at a time. It causes some inflammation and gum bleeding. It can be unpleasant to have that done, but it's a necessary part of breaking up the biofilm and getting rid of the bad bacteria. Then we have to work on the host immunomodulation. I have to not be so reactive to that bloody mess. I need to calm my immune system down. That means all the therapeutic lifestyle things that we all know to do. We have to sleep 8 hours restfully every night. We have to spend time daily in gratitude and prayer and meditation to get our sympathetic nervous system out of fight or flight, get it down into rest and digest. We have to make sure that we're not backwashing acid from our stomachs up into the back of our throat every day. That acid reflux can be terrible for our mouth bacteria. So talk to your naturopathic or your enlightened primary care doctor about a way to treat and restore your gut health and get rid of that acid reflux. And I don't mean taking that purple pill every day. That's not the solution for this, right? We want to make sure that we have good quality sleep.
Thank you for being part of our audience. And Dr. Campbell, thank you again for your wisdom, your time, and pioneering the way in just helping people live better, healthier lives.
You're so welcome. It's my honor.
All right, everybody. We'll see you next time. Thanks again. Bye.